I'm Faye Watt, and let's queer up South Florida and Florida. Historic leadership change at Broward County HIV Health Services Planning Council. Tonight, we bring you a story about leadership that has shaped Broward County during one of the most uncertain periods for public health in the state of Florida. It's a story about the power of voice, the importance of representation, and the courage it takes to guide a community when the landscape around you is shifting. For 6 years, advocate, educator, and Queer News Tonight anchor Vaughn Biggs has served on the Broward County HIV Health Services Planning Council. Florida is in a moment of deep transition. Funding models are changing, medication access is being restructured, programs that once supported thousands are facing new restrictions and new eligibility requirements. The Florida Department of Health is exploring approaches that may shift responsibility to local systems that are already strained. Across the state, communities are raising concerns about whether people living with HIV will continue to receive the care, stability, and medication support that have kept them healthy for decades. In this kind of climate, leadership inside the Ryan White system say that they view their role as less of a formality and more of a safeguard. Pending changes to program eligibility and coverage serve as a reminder that lives are at stake, especially when policy decisions become distant from the reality that people face in their daily lives. Advocating at the Broward County HIV Health Services Planning Council becomes a voice that asks the room to slow down, to look deeper, and to consider who might be harmed by a quick vote or a rushed assumption. This has been the way Vaughn Biggs has led during his tenure. Now, as he steps out of his leadership seat, the Planning Council prepares for a new moment in its history. For the first time, a transgender woman will serve in this leadership role. Franchesca D Amore, who shares this anchor desk with us on Queer News Tonight, has grown into this position through dedication, curiosity, and a genuine desire to serve her community. Her leadership marks an important change. Tonight, we speak with both about what this transition means for Broward County, for Florida as a whole, and for the future of HIV planning. And it means so much that both of you are here at the table today at Queer News Tonight. You both are usually here. You're here a lot. So I'm going to say this real simple. This one really hits home for a lot of us. When we talk about HIV leadership in Broward, we're not talking about theory. We're talking about our friends. We're talking about our community. We're talking about our own lives, and Vaughn has been in these rooms fighting to make sure that people weren't just numbers. And now Franchesca is stepping into that role, Baby, that's not historical. That's personal for so many of us watching right now, And in a moment where Florida is playing games, with healthcare, this kind of leadership means everything. We don't just want it. It's a necessity right now, So Vaughn, I've watched you in this space, and I know that your heart, when you're sitting in these rooms making these decisions, who are you thinking about when you're making those decisions? Who are you fighting for, really? And let's be real, were there any moments that you've wanted to walk out in frustration after seeing some kind of news story come across your computer?
Oh, well, no. Well, first off, the tenure is ended. So, we're allowed to serve two-year terms. Mm-hmm. So, and a lot of people think we're all volunteers. All of us are volunteers on this. We serve on 6-7 meetings a month, and it's all during the day. It's, we're taking time away from work. We're going to these things. So,
from your own lives.
From our own lives.
Yes.
And for me, it was about representation for people like myself, or at the time when I moved down here, my partner. I noticed that his health care was handled differently than mine. And as a young Black man, we were seeing the same doctor, and it wasn't managed the same. We had the same insurance.
Wow.
So it made me really step into I had advocacy in my background anyway, but just advocating for family, grandmothers, things like that in the hospitals. But it turned so personal here that's really what drove me to be part of that planning council and to learn everything that I could. And I feel like I've done that. And I remember meeting Franchesca. How many years has it been? 3 years? 3 years? And I walked in and was like, "Hi, who are you? Are you new?"
I was like, "Girl,
no."
I ain't into it.
So to see the stories, you have to represent the whole community. And I am one that want to hold our providers. And when I say providers, it's the people who are getting the funding for Ryan White to take care of services for people living with HIV. That they're doing what they need to do, and they're doing it with the dignity and responsibility that they've been given. And sometimes we have to call them out for that. And it's something that we don't like to do on a planning council. We don't like to call out their names. We don't. But there's been times I've had to. And it's not something they like at all, but
Can you give us an example without naming a name?
Well, for example, we had, I'm going to use a food program, and it was like people get access to food services. And I noticed the quality of food wasn't the way it was supposed to be. So the night before planning council, I happened to go by and get a sample of the food and came in the next day and just dumped it on the table in front of everyone. And that's what an advocate does. That's what me as an advocate does. I have to change the way people think. Like, is this something that you would pick up, you sitting around the table here when you go to the grocery store? No, it would not be. And they changed what they did. And at the end of the day, that's what matters.
Yeah.
I made that impact by doing that. And sometimes we have to stand up, and sometimes we have to say things that are hard. And that's whether you're looking at cutting a service or whether you're cutting, realizing that these funding restrictions coming down, what can we do to get the best care? Ryan White was created to provide health insurance and medication. Luckily, we've had enough funding that we've been able to do other services. And now they want to try to still do everything, but don't reduce the federal poverty level on people just to cut them out so you can have money to give food to somebody. We need everybody to have access to medical and medication.
We just had a meeting here about ADAP, AHF was here, and there was the whole sanctuary was full of people worried.
Yeah.
Worried about their future, and folks that had been on certain meds for decades, right? And that, had tried a slew of other meds, and, they didn't work like this. And now all of a sudden this was not available by or covered anymore through their insurance. People were freaking out, Vaughn, and Franchesca, you're stepping into, first of all, sister, I'm so proud of you, okay? You are ridiculously talented. You are a light. Wherever you walk in, people take notice and want to be around you, want to learn from you, want to just be your friend, and you're like, I got enough friends, right?
True story.
Stepping into this role, and how anal Vaughn is with everything, and how detailed and how crazy he can be about these kind of things, I'm not lying, right? That's what makes him such an incredible specimen, right? Sure. And so you're walking into these big shoes with a lot of expectations, plus a lot of fear. There's got to be fear there from everything that's going on. How does this all wash over you?
It's really, we wear the same size, so stepping into Vaughn's shoes was actually first off.
Wow.
And I love that, when I was nominated, I was honored just to be nominated. And then when I was elected, I was like, I took a week to really think about it, because this is a really important position, especially for the first trans woman to step into. And we have very different leadership styles. I'm a little bit more demure in my approach to things, which is my strength in a lot of different ways. But in this day and age, we have to really listen to what our clients are saying. I myself am a 29-year survivor and thriving with HIV. So I have a lot of thought and insight and lived experience to bring to the table. And I just went to school and graduated from FSU College of Law in healthcare regulations because I wanted to learn more so I could be the most effective advocate here that I can be. So now we have all these ADAP slashes that are proposed and happening. If you do want to make a change, you can actually go to flrules.org. The Department of Health is accepting public comments. So anyone at this table or anybody out there can actually go and provide a commentary so that they can hear from the public. So we are given a voice that wasn't given to us. That procedure wasn't given to us.
Yeah.
And I've learned a lot from Vaughn. I've learned a lot from everyone else in the room that I've been in. And when I gave my little speech to be nominated, my whole ground was I represent everyone. I represent every demographic that's affected by HIV, because HIV doesn't have a face if you really look at it. There are some demographics like brown and black women. That's the highest rate of infection in South Florida. That's a lot. Globally, the highest rate of HIV/AIDS is brown and black women.
Yeah.
So we have to focus on all these different demographics. And these cuts are devastating right now to our community. And if things aren't shifted, viral rates will go up and we'll step back into the 90s again, which is really scary. And that's why all advocates, all people really need to get on board and shout and be present. And, you know, there are so many other great organizations, AHF, CAN, so many other organizations that have really rattled the cage on this. So I think it's all going to be okay at the end of the day.
I hope so.
In looking at it at the system, there were changes that needed to be made to begin with. So I see opportunity more than I see chaos. So I see a lot of opportunity for us to restructure things and step into a new era of providing the best possible holistic care. I'm a big proponent of holistic care for any client or any patient. You know that I'm a holistic life coach, Reiki, food, mental, substance abuse. All of these things are really key in getting somebody healthy and learning how to live the best life that they can, you know?
Yeah.
And there's a big stamp put on HIV that, oh, people are like not dying of HIV, but we also have to remind people that yes, people are dying of AIDS still.
100%.
And, you know, people are taking meds, but they're poison, you know? And I often say to myself, how am I still living at this age, you know?
Yeah.
And I live my life with gusto, but I also do all the holistic things that I've needed to do to be the person I am today. So that's going to be one of my leadership things I'm going to really push at the table.
I love that.
Yeah,
I love that. I mean, I remember we were sitting at this very table when we did a news story months ago about the global cuts. Okay. And Vaughn was here beside himself, just worried about the possibility of a new strain, the possibility of what our future could look like. You know, we sit with a lot of gentlemen that are a little older than the folks at this table that have survivor's guilt because they were around during the AIDS crisis and they lost so many friends. And you see these cuts and you see folks losing their medication and you're like, oh my God, can we go back to that? You know, like, or will we go back to that? You know, Franchesca, you're a beautiful trans woman coming into this role. What can you tell another beautiful trans person that is watching saying, hey, look, I'm being represented and look at her role. Look what she's doing. I can do it too. You know, can I do that too? What can you tell that person?
So it's so interesting. In my years of advocacies, I've gone to the forefront and I've receded. And I think just by being yourself and doing what feels organic to you as a person, you know, there's no gesture or action that's too big or too small to make a change in this world. So I say, whatever is organic to you and authentic to you, just be authentic about it, you know? Don't follow a path that you think other people want you to follow. Just do you. Sometimes just showing up and being kind to somebody is the biggest form of advocacy or representation ever.
100%.
Right?
Because both of you are incredible humans and you bring that human factor in. Like healthcare makes you feel like a freaking number. You know, it's like, okay, does your insurance cover? Nope, bye, here's your out of pocket. And like, that's it. That's as much as human kindness that there usually is at these. You know, both of you lead with your hearts, you know, and with your brains, of course. But I mean, I can see that aspect. Are you planning to bring that into the role?
Absolutely. I think it's really important to also bring compassion into the formula and as a part of the solution to ending the HIV epidemic, right? There's a lot of stigma out there. As a trans woman, I date primarily straight men, right? And it's been really interesting on my journey to have to educate these men because I've dated a lot of men that have never dated a trans woman before, and I've had to educate them. And I've been really surprised at actually how open a lot of these men have been to the education, and then some people haven't been. But I think it's our duty to educate people and let people know, first of all, right? It just starts with you, everything. And I think like compassion is so important, and treating the person holistically that's dealing with so much stigma. I mean, even in this day and age, there's so much stigma. And sometimes I hear people talking about HIV and AIDS in a way that I'm like, wow, people still think that way. And we put so much education out there, and I experience it. I see it. I don't take it personally, but I know that it doesn't help propel us forward in the fight against HIV and the fight against stigma. And stigma, I think, is like one of our biggest obstacles. Self-stigma and then stigma from society. So if you meet somebody with HIV, we're cool. Just love us.
We're cool.
Whatever.
When is your last day, Vaughn, and when do you hand over the reins to the beautiful Franchesca?
So my last official due is this Thursday, actually. So we have our yearly annual retreat that we go through, and once Lorenzo and I finish our duties as chair and vice chair, then I'm not going away, which is a good thing.
You busy, honey.
I know, but and I said this. I always said this. Vice chair role has a very great voice to use. I've learned to be able to use that voice as a vice chair because the chair all they can do is run the meeting. We have to run a meeting as under Robert's Rules of Order because we're under the commissioners. Mm-hmm. So we have to run a meeting just like if you would go to the courthouse and see a commissioner meeting ran. It's ran the same way.
Boring.
With Mr. Chair, I move, I second. I mean, it's all done that way. And the chair, that's their responsibility is to make sure that meeting runs exactly like that. Mm. And it's the vice chair that supports the chair, but then also gets to have a very powerful voice. Me now gets to step back and be a community member, and I actually have a louder voice because I don't sit in a seat. And that can be challenging and probably
I doubt it'll be
scary.
That challenging.
Not challenging for me, challenging for them to hear me.
Yeah.
But that, and then I'm stepping into other roles. I'm doing the next 5 HIV conferences in the country where I'm speaking on national stages. So I'm taking it to the road, so to speak.
Love that.
Yeah.
Well, I love that. I'm proud of both of you. Yeah. Thank you both for sharing your news here on Queer News Tonight. And folks, this isn't just about leadership change. This is what it looks like when community takes care of community. Right? Yeah. You're seeing it right here. And folks, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.